All right, so get this. Today we're diving deep into the world of parathyroid adenoma localization.
Ooh, that's a mouthful.
It is. But basically we're talking about how doctors pinpoint these tiny glands before surgery.
And you know what? We actually have some medical excerpts that you shared with us.
Yeah, this one's personal for you listening, so we're going to break it all down.
We're going to make it make sense.
Exactly, even if you don't have a medical degree.
Absolutely.
Yeah.
And I think you might be surprised by what we uncover.
All right, to kick things off, can you give us like a parathyroid 101? What exactly is primary hyperparathyroidism?
Okay, so picture this. You have these 4 tiny glands in your neck. They're called parathyroid glands.
Okay, I'm picturing it.
They're like little calcium regulators, right?
They keep everything balanced.
Exactly. But in primary hyperparathyroidism, one of these glands decides to go rogue.
Oh.
Usually it's because of a benign tumor called an adenoma.
Okay.
And this adenoma, it just starts churning out way too much parathyroid hormone.
And that messes with your calcium levels.
Big time. It can lead to all sorts of problems.
Like what? Give me some examples.
Well, you could experience fatigue, kidney stones, even bone problems.
So definitely not something you want to ignore.
Definitely not.
So when surgery is needed, why is it so important to know exactly where this little troublemaker is hiding?
Well, think about it. If the surgeon knows exactly where the adenoma is, they can be much more precise.
Minimally invasive, right?
Exactly. Smaller incisions, faster recovery times, fewer complications. It's a win-win for the patient.
Okay, I'm all about minimally invasive, but how do they even find these things? These glands are minuscule.
Right. It's like looking for a needle in a haystack.
Seriously.
But that's where medical imaging comes in, and that's where the detective work starts.
Ooh, I love a good medical mystery.
So one of the techniques they use is called sestamibi scintigraphy.
Say that 3 times fast.
Right. Luckily, it's also known as MIMBI.
MIMBI, much easier.
Much easier. So with MIMBI, they inject a radioactive tracer that gets absorbed by those parathyroid glands.
Aha, so they light up on the scans?
Oh. Exactly. It's like a homing beacon leading the doctors straight to the source.
I like it. But I'm guessing it's not always that simple.
You're right. Sometimes MIMBI alone isn't enough. The images can be a bit blurry.
Okay, so what do they do then?
They bring in the big guns SPECT, which stands for Single Photon Emission Computed Tomography.
Okay, that sounds intense.
It is pretty cool. It takes those MIMBI images and turns them into 3D pictures.
Oh, so they get a much clearer view of what's going on.
Exactly. They can see the adenoma size, its shape, and its exact location.
So MIBI and SPECT, they're like partners in crime fighting.
I like that analogy. They work together to pinpoint the adenoma.
Awesome. Now, what about ultrasound? That's a pretty common imaging technique.
Oh, absolutely. Ultrasound definitely has a role to play in this, too. It uses sound waves to create images of the neck.
So they can see the glands in real time.
Yeah, it's pretty amazing. It's especially useful when the adenoma is fairly large or in a spot that's easy to see.
So like a live feed from inside the neck.
Exactly.
So we've got MIBI, SPECT, and ultrasound. All great tools. But do doctors ever have a preference for one over the other?
You know, they do. Because each technique has its own, pros and cons.
Makes sense. So what might make them choose one over another?
Well, for example, let's say a patient has had prior neck surgery.
Okay.
Ultrasound might not be the best choice in that case because of potential scar tissue.
Ah, that makes sense.
In those situations, 4D CT might be a better option.
4D CT, that sounds pretty futuristic.
Oh, it is. It's like taking images over a period of time,
So they see the adenoma in action.
Exactly. They can see how it's moving, its relationship to other structures.
And that helps them plan the surgery even better.
Absolutely. Especially in complex cases or when someone needs a repeat surgery, 4D CT can be invaluable.
Wow. It's like getting a sneak peek before the main event.
It is. And it allows surgeons to, really tailor their approach.
So they're not going in blind.
Not at all. Yeah, we've talked about all these high-tech imaging techniques, right? But are there times when doctors need to use, I guess you could say, more hands-on approaches?
More invasive techniques.
Yeah, exactly. Sometimes the non-invasive imaging just doesn't give them a clear enough picture.
Okay, so what happens then?
Then they might turn to invasive localization procedures.
Like what?
Well, one example is selective venous sampling.
And how does that work?
So they insert a catheter into a blood vessel and measure the parathyroid hormone levels.
Okay.
This helps them pinpoint the source of that overproduction, zero in on the culprit.
So it's like a targeted mission to confirm the adenoma's location.
Exactly.
But I imagine it carries more risks than the non-invasive techniques.
You're right, it does. That's why it's usually reserved for those tricky cases where the other imaging hasn't been successful.
So it's kind of like the ultimate confirmation tool.
You could say that, but what happens if, even after all of this, the adenoma is still playing hide and seek?
That's a great question. What do they do then?
Well, that's a perfect segue into the next part of our deep dive.
All right, cliffhanger. We'll have to wait and see what happens next.
Stay tuned.
Okay, so we've got our high-tech treasure map, but
Mhm.
what happens if, X doesn't actually mark the spot?
Right. Sometimes, even with all the fancy imaging, that adenoma can be a real ninja.
A stealthy little gland.
Totally. It might be hiding in a weird spot, or it could be super tiny, just blending in.
So it's not always a clear-cut case.
Well, not always.
Yeah.
But surgeons, they've got some backup plans for these situations.
Like what? What do they do when the imaging isn't perfect?
Well, they've got years of experience and training, right? So
Mm.
they're really good at visually identifying those glands.
It's like parathyroid whisperers?
Yeah, pretty much.
Yeah.
But they also have this amazing tool called intraoperative parathyroid hormone monitoring.
Okay, break that down for me.
Basically, they monitor your hormone levels during the surgery.
Wait, they're checking your hormones while you're on the operating table?
Yep. They take blood samples throughout the procedure and analyze those parathyroid hormone levels.
And that tells them what?
Well, when they remove the overactive gland, the one causing all the trouble,
Right.
the hormone level should drop, like way down.
It's like an instant confirmation. Right. They know they got the right one.
Exactly. It's like a green light saying mission accomplished.
That's incredible. So even if the imaging isn't perfect, they have this backup system to guide them.
Precisely.
Yeah.
It's like having a GPS even when your map is a little fuzzy.
I love that. So they're using both their expertise and this real-time monitoring.
Teamwork makes the dream work, right?
Absolutely.
Yeah.
Now, remember that A to G naming system we talked about?
Uh-huh.
Does the adenoma's location actually affect how tricky the surgery is?
Oh, you bet it does. Think of it like this. Some locations are like prime real estate, easy to get to,
Okay.
and then others are, tucked away in the back alleys, harder to reach.
So like an adenoma in the E position, that's the easy one to remove.
Exactly. But if it's hiding behind other structures, things can get a little more complicated.
So the surgeon needs to be even more skilled in those situations.
Definitely. They need to know the anatomy, like the back of their hand.
Makes sense. Now, I'm sure this is on everyone's mind. What are the chances that this surgery actually fixes the problem?
Right, because surgery is a big decision.
Yeah, you want to know it's going to be worth it.
Absolutely. The good news is parathyroid surgery has a really high success rate.
Like how high?
We're talking over 95%.
Wow, that's amazing. So most people just have the surgery and then they're good to go.
Yep. Calcium levels go back to normal, symptoms disappear. It's like hitting the reset button.
That's fantastic. But I imagine every case is a little different, right?
Oh, absolutely. Everyone's body is unique, so there's always some variation.
It's not just about the numbers. It's about the individual person.
You got it. And I think that's something we should delve into a bit more.
You're right, there's a whole human side to this that we haven't explored yet.
Exactly. Let's shift gears and talk about the patient experience in the final part of our deep dive.
Okay, so we talked about the technology and the surgical side of things. But let's be real for a minute. Getting a diagnosis like this, it can be scary.
Oh, absolutely. It's a lot to take in all those medical terms, the thought of surgery.
It can really mess with your head.
It can be overwhelming, for
Yeah.
sure. And then there's the whole decision-making process.
Right, like, do I have surgery? Are the risks worth it?
Exactly. Weighing the pros and cons, trying to figure out what's best for you.
It's a lot of pressure.
It is. And that's why knowledge is so important,
Absolutely. The more you understand, the more empowered you feel.
Exactly. When patients understand their condition and the treatment options, they can make informed decisions.
Decisions that feel right for them.
Exactly. It's all about, taking control of your own health.
And that's where resources like this deep dive come in.
Absolutely. We're breaking down complex information, making it accessible.
And hopefully easing some of those anxieties.
Exactly. And this is just the starting point.
Right. It's not a replacement for talking to your doctor.
Not at all. But it can help you prepare for those conversations.
Ask the right questions. Be an
Oh, yeah.
active participant in your care.
Exactly. It's all about that collaboration between patient and doctor.
Working together to find the best path forward.
Exactly. So we've covered a lot of ground in this deep dive, right?
We have. From high-tech imaging to the human side of this whole experience.
It's been quite a journey. And, as we wrap things up,
Yeah,
I think it's important to remember that we're constantly learning and evolving in medicine.
absolutely. What we know today might be different tomorrow.
Exactly. And that's exciting, Think about how far we've come with imaging and surgical techniques.
It's mind-blowing. And who knows what the future holds?
Right. There could be even more precise, less invasive treatments on the horizon.
That's the hope.
Mm-hmm.
And for anyone listening who's dealing with this diagnosis,
Yeah,
just remember knowledge is power.
absolutely. Keep asking questions, do your research, and advocate for yourself.
You're not alone in this journey. And on that note,
Yeah.
we're going to wrap up this deep dive into parathyroid adenoma localization.
It's been a pleasure exploring this with you.
Thanks for joining us. And remember, stay curious and stay informed.